Alright, let's dive into something that's been making waves in the healthcare world: MUSC Health being ranked South Carolina's #1 hospital and cancer center by U.S. News and World Report. Now, before you think, oh, just another hospital ranking, let me tell you why this is actually a big deal. First off, this isn't their first rodeo, it's their 12th consecutive year at the top. 12 years. That's not just luck, it's a testament to consistency and excellence. But what makes this really interesting is the broader context. MUSC isn't just a hospital, it's South Carolina's only public statewide health system. So, when they excel, it impacts the entire state. Personally, I think this highlights a larger trend in healthcare: the growing importance of regional powerhouses that can deliver world-class care without forcing patients to travel far from home. Now, let's talk about their cancer center. MUSC is home to the state's only National Cancer Institute designated cancer center, and it's ranked #1 in South Carolina for cancer care. What many people don't realize is how rare and prestigious that NCI designation is. It's not just about treating cancer, it's about being at the forefront of research and innovation. This raises a deeper question: how does a single institution manage to dominate both clinical care and cutting-edge research? In my opinion, it's because MUSC has built a system where education, research, and patient care are deeply intertwined. They're not just treating patients, they're training the next generation of healthcare leaders and pushing the boundaries of what's possible. Another detail I find fascinating is their obstetrics and gynecology program, which jumped from number 16 to number 10 nationwide. That's a massive leap. It's not just about the ranking, it's about what it implies. Women's health is often overlooked in broader healthcare conversations, so seeing a program make such strides is encouraging. From my perspective, this speaks to MUSC's commitment to holistic care. They're not just focusing on high-profile specialties, they're elevating care across the board. Now, let's zoom out for a second. MUSC has 23 procedures and conditions designated as high-performing, from arrhythmia to stroke care. What this really suggests is that their excellence isn't siloed in one area, it's systemic. If you take a step back and think about it, this level of consistency across specialties is rare. Most hospitals have a few standout departments, but MUSC seems to have cracked the code on delivering top-tier care across the board. One thing that immediately stands out is their focus on patient outcomes and experience, which aligns perfectly with the updated U.S. News and World Report methodology. It's not just about survival rates, it's about how patients feel and how well they recover. But here's the thing: what does this mean for the average person in South Carolina? Personally, I think it's a game changer. Having access to this level of care in your own state means fewer people have to travel for treatment, which can be life-changing, especially for those with rare or complex conditions. What many people don't realize is that healthcare accessibility is just as important as quality. MUSC is bridging that gap. Finally, let's talk about the bigger picture. MUSC's $10.1 billion operating budget and 37,000 plus team members aren't just numbers, they're a reflection of scale and ambition. In my opinion, this is what modern healthcare should look like: a massive, integrated system that combines education, research, and patient care to serve an entire state. But this raises a deeper question: can other states replicate this model? Or is MUSC's success tied to its unique position in South Carolina? As we wrap up, I'll leave you with this thought: MUSC's rankings aren't just a win for the hospital, they're a win for South Carolina. But they also set a new standard for what healthcare systems can and should be. So, here's my question for you: what does it take for a healthcare system to truly transform care for an entire state? And how can we ensure that more regions have access to this level of excellence? Let me know your thoughts in the comments below. I'm curious to hear what you think.